Hi everybody, this is Summer with Done Naturally, and we are going to work on hand expression, and we are also going to talk about breast massage and breast compression. And I have a handy dandy breast model. Very exciting. Okay, here we go. So let's first talk about breast massage. And a lot of lactation consultants will talk to mothers about how this can be helpful before pumping and even during pumping to kind of tell the body to wake itself up and start making some milk. And even massage during pumping can help mothers produce more milk. It's been shown that 50% more milk can be collected with hands-on pumping or breast massage during pumping. So when we do breast massage, it's very similar to monthly checks that you're supposed to be doing to rule out cancer. So what we do is we gently kind of move our fingers around the breast in a circular fashion, just like this. And you can also do things like this to help wake up the breast, okay? We're not doing firm pressure, anything that's going to leave a bruise or hurt, so it's gentle. Another thing that we can do is what's called breast compression. And this is particularly helpful with mothers who maybe have a baby that is not nursing very well, really sleepy at the breast. We want to get that baby drinking a lot more or increase milk transfer for the baby and also increase pumping output. So when we compress, we are going to be far away from the nipple. So we might be right around here. And what we're doing, and I'll show you from the side, we are just doing this. Okay, and it can be anywhere around the clock, so to speak. So you can place your hands here. The baby would be breastfeeding. Your hands are here and you're going to squeeze and you're going to hold. You're not like milking a cow. We're not milking a cow. So we're just compressing and holding. Dr. Jack Newman has a whole great, really explanation on breast compression. And he talks about basically what we're doing is watching for drinking. And if we're not seeing drinking, then that's when we need to compress. So that compression can stimulate the breast to let milk down and further push milk into the baby to remind them to start drinking. This action here should stimulate them to start drinking. If they do, we keep the compression going. If they don't, or maybe they drink for a little bit and then they kind of stop and start pacifying or non-nutritive sucking, then we let go. Give our hand a little break and a shake, and then they may start drinking again on their own, which is awesome. If they don't, then we compress again, okay? So the compressions are used in conjunction with watching for the activity of their swallowing, their jaw, and audibly hearing swallowing. But remember, we're not just doing this over and over and over again. It's a compression and a hold as long as that helps them release for a break. And if they need more enticement to swallow, compressing again and working around the clock of the breast as you need to, because some areas may be more responsive than others. Now let's talk about hand expression. So hand expression can be super useful for just prophylactic care of the nipple. As we know in videos above, you see how much medicine there is in breast milk, and using your own breast milk to apply onto your nipple can actually help healing and help with any like normal tenderness after delivery, or even if we have some minor abrasions. So when we express, and I teach mothers this, many women, once taught correctly, can really be very good at hand expression, but a lot of times they're trying and they're just not using the right technique. So they may express and think there's no more milk left, and then when they're taught properly, they realize, wow, there's always milk inside of there. So what we do is we're gonna place our fingers around the nipple and the areola. We're not gonna be touching the nipple at all. That squeezing of the nipple doesn't get any milk out and it hurts. So we're not doing that. So when you place, you're gonna use your forefinger and your thumb, and you're gonna place on the outside edge of the areola. The areola is the dark circle around the nipple. A lot of times there are little, we call them Montgomery glands, but they look like little pimply bumps around the base of the nipple, and those secrete an oil and often milk, and this helps keep the nipple clean and safe. So We're gonna place our fingers here. It's usually about an inch away from the base of the nipple shaft. So here's the base of this nipple shaft. And not all nipples look like this, obviously, and most areolas are quite a bit bigger than this. This is kind of ridiculously small. If you have a nipple like that, no, I did not mean to offend you. So, okay, areolas, nipples, they're all different sorts of size and shapes, and all of them are normal. So we're gonna go about an inch from the base of the nipple shaft. This is the nipple shaft here. So an inch from that base, it's gonna be about here, okay? And again, with hand expression, we can move anywhere around the clock of the breast. So we are going to place our fingers. We are going to press directly back into the chest wall, okay? So from the side, this looks like this, pressing into the chest wall. It does not look like this, spreading our hands. Many, many women do this. They'll spread and squeeze. We want to just place our fingers, have our fingertips exactly opposite the line of the nipple, okay? So we're not using a hand like this. A lot of moms will try like this, but then we're using this piece of our finger. We want this and we want in. So we're placing, we are pressing in towards the chest wall. Okay. After that, we stay back. We stay pressed into the chest wall, and then we're just going to bring our fingers together like a sandwich, and we're going to stay behind the nipple. So when you see me squeezing, we're pressing into the chest wall, and we squeeze, make the sandwich, and you'll see the milk often spray. Now, if we're in the early first few days, we're not going to see spray, but you'll see drops of colostrum come out. And if we're farther on into lactation, when you compress and make that sandwich, you're going to see a lot of spray coming out of the nipple pores. So once you do it again, so we're going to press into the chest wall, we're going to compress and make that sandwich, and then to do it again, all you do is release and stay back there. We're not coming down in. A lot of moms will squeeze and then stretch the nipple out like this. Stop that. It's going to hurt. So we're placing, pressing back in, making the sandwich. And then you stay there and you just keep squeezing like this. If you find a magic spot, and a lot of people have a spot that responds a lot more than another, experiment. Does 3 o'clock and 9 o'clock work? Staying here and squeezing? You know, is it more like 11 and 5? 2 and 7? What is it? But we are placing, pushing back into the chest wall, making that sandwich, and then just continuing like that, staying clear of nipple squeezing. We're really close to the nipple, not pulling the nipple like this. And when we place directly into the breast, we are not stretching the skin, and we are not starting here and squeezing down. We're not starting way back here. That's breast compressions when you start back here. Hand expression, which I know they sound similar and can be confusing, but hand expression is here in squeeze. Compressions farther away when baby is breastfeeding, like this. Breast massage, gentle touches, little circular motion like this. That is my breast model, hand expression, breast compression, and breast massage. You guys have a good day. Give me a thumbs up if you like. Subscribe, and I will see you another time. Bye.